In the challenging world of chronic wound care, especially for conditions like diabetic foot ulcers where healing is sluggish, infection risk is high, and tissue regeneration is painfully slow, scientists are now turning to an unlikely but promising ally: yogurt. Or more precisely, the bioactive compounds within it. The concept of yogurt-based hydrogels, therapeutic gels derived from fermented milk, sounds like a culinary accident turned science experiment, but the idea is gaining traction as a legitimate platform for diabetic ulcer treatment. What was once a breakfast item is now being reimagined as a wound-healing matrix. At the heart of this innovation are the bioactive elements generated during yogurt fermentation. These include short-chain peptides, probiotic-derived extracellular vesicles, EVs, lactic acid, and other fermentation byproducts known for their antimicrobial, anti-inflammatory, and regenerative properties. When integrated into a hydrogel scaffold, a moisture-retaining, skin-adhering matrix, these molecules can create a local microenvironment that's incredibly conducive to healing. And in the hostile terrain of a diabetic foot ulcer, where the immune system is dysregulated and vascular flow is impaired, this kind of biochemical support can make all the difference. One of the key benefits of yogurt-based hydrogels is their ability to promote angiogenesis, the formation of new blood vessels, which is critically impaired in diabetic wounds. Studies suggest that certain probiotic strains, particularly Lactobacillus plantarum and Lactobacillus rhamnosus, release metabolites that upregulate VEGF, vascular endothelial growth factor, expression in surrounding cells. Incorporating these components into a hydrogel means that, instead of simply covering the wound, the material actively stimulates the growth of new capillaries. That's like turning a bandage into a tiny vascular construction site, complete with pro-growth instructions and supportive infrastructure. At the same time, these yogurt-based gels bring a potent antimicrobial advantage. The acidic pH of yogurt byproducts, combined with antimicrobial peptides and bacteriocins produced by probiotic strains, creates a hostile environment for pathogenic bacteria like Staphylococcus aureus and Pseudomonas aeruginosa, the usual suspects in diabetic wound infections. Traditional antibiotic treatments often struggle with biofilm-forming bacteria in ulcers, but yogurt-derived molecules have been shown to penetrate biofilms and disrupt bacterial communication, quorum sensing, helping to clear infection without contributing to antibiotic resistance. It's wound care with a bit of microbial sabotage baked in. Moreover, the gel's lactic acid content not only discourages pathogen growth, but also helps modulate the local immune response. Chronic wounds in diabetic patients are often locked in a pro-inflammatory state, with excessive neutrophil activity and poor macrophage transition. Yogurt-based hydrogels, rich in probiotic-derived EVs and lactic metabolites, appear to shift this immune profile toward resolution and repair. This isn't just soothing the skin, it's immunological reprogramming on a localized, topical level. From a material science perspective, yogurt's protein content, especially casein and whey fractions, can be cross-linked into structurally stable gels that are both biocompatible and biodegradable. These hydrogels adhere well to moist wound beds, maintain oxygen exchange, and can be infused with additional therapeutic agents, like growth factors, stem cells, or antibiotics if needed. And being food-grade in origin, they're safe, inexpensive, and scalable, 3 words that rarely show up together in biomedical innovation. Of course, challenges remain. Standardizing the bioactive content of yogurt-based hydrogels can be tricky due to batch variability and fermentation conditions. Regulatory approval would require rigorous validation to ensure purity, sterility, and consistency. But the platform's potential is significant: a natural, multifunctional dressing that not only protects but also regenerates. In the future, the management of diabetic foot ulcers might involve not just high-tech sensors and synthetic biomaterials, but also a gentle, creamy gel born from fermented milk, quietly delivering healing messages to damaged tissue. It's a poetic reminder that sometimes the most advanced solutions are rooted in the most ancient foods. Only now, they're being refined by science to heal more than hunger.